Hi, I'm Ashwin. I have chosen Maya as case study for my video presentation. Myras is a non-profit organization. It cooperates with families, professionals, communities to provide a support service to empower people. It offers individual service to meet the needs of people, especially those with disability, to live valued and fulfilled lives. Myras runs as a charity organization and was first registered in 1985 as an opportunity housing trust. It uses well-trained professionals to support people with learning disabilities, autism, mental health conditions, and complex needs. It is funded through various channels such as personal funded arrangements, health boards, and local authorities. It encourages people to get together and to make a positive impact on their lives. Let's look at the leading indicators. First, I'm going to talk about the safety audits. Myers uses safety audits to measure the workplace illnesses, injuries, to optimize safety health performance, to reduce relevant and to reduce relevant cost. It has formally safety audit at regular intervals. For instance, the health and safety manager conducts 2 audits per quarter. It was also conducted a third-party audit to improve the health and safety outcomes. These audits are the normal part of the business and found considerable evidence for the good practice. For example, the organization has a good existing control that ensures there is no presence of asbestos in the buildings. Regularly audits helps to identify the potential hazards that proactive measures address them, leading to better safety health outcomes. Similarly, the British Red Cross performs a safety audit to assess safety measures and identifying the areas that need to improve OHS outcomes. According to Robertson, the safety audits can be used to measure an organizational OHS performance. Moving into the incident and near miss reporting. Myers has a policy in place that ensures the incident and the near miss are reported. This helps to identify the weakness in the risk management programs and address them to prevent the incident in future. Overall, the Myers has a fairly consistent pictures of accident and near miss reporting. The reporting rate is increased to 47%, showing that the increase in reporting the most of the service. For example, the accident and the near miss report increased from 17 in the third quadrant of 2017 to 34 in the first quadrant of 2018 in Bridgend. Also increased in Gwent from 5 cases um, to third in the third quadrant of 2017 to 16 cases in the first quadrant of 2018. However, some surveys such as LANS shows poor incident reporting, such as 0 reported in the third quadrant of 2017, and 1 and 2 reports are only in the fourth quadrant. Similarly, Unilever UK focus on improving reports of all incident and near misses, investigate and follow up improves OHS outcomes. According to Shinanikov, 2013, the rate of incident reporting and the near miss can be used to measure the performance of OHS programs. Let's look at the risk assessment. Uh, NIRAS uses risk assessment to predict and prevent incidents in the workplace and to improve safety health outcomes. It conducts workplace and improve safety and well-being outcomes. It conducts office risk assessment satisfactorily. It also conducts several fire risk assessment and review annually to assess the risk of the fire and take measures to reduce the risk. For example, the manager in Cardiff performs 6, 7, 9, and 10 fire risk assessment reviews in the quarter of 2, 3, 4, and 1. However, the poor performance is reported in some areas such as Gwent, which reports 0% of safety risk assessments in manual handling sector. Similarly, the British Red Cross has a risk committee responsible to review the risk assessment to reduce the potential hazard and to improve safety and well-being of the staffs. According to the Occupational Health and Safety Administration, organization can use the frequency of a risk assessment to measure their implementation of recommended wages practice. If we look into the safety training, IRS offers safety training. It has first day induction for every new employees. It has focus on various issues including safety arrangements. It has 12 weeks induction programs that introduce workers to issues and health and safety related policies. And there is also an ongoing monitoring process that ensures that employees' practice reflects the training. According to the staff survival organizations offers excellent training that improves safety and well-being. Similarly, Unilever offers health and safety training to ensure safety and well-being of its employees. According to Health and Safety, Occupational Safety Health Administration, the number of trainings on safety for the workers can be used to measure the OHS performance. Now I will talk about the lagging indicators, and here let's look into the reported accidents. Accidents are the bottom line numbers used in evaluating the overall efficiency of the organization's safety and well-being. In the period of 16 to 2017, the MIRAS experienced 128 to 120 accidents. This shows that much needed to be done to reduce the accidents and to improve OHS outcomes. Unilever also uses occupational injuries and accidents to improve OHS performance. This helps to evaluate the performance of previous measures and identify the areas that need to improve. According to Shinanika 2013, the lagging indicators such as workplace injuries, fatalities are the direct measures of OHS performance. Therefore, MIRAS can use the indicators to determine the effectiveness of its OHS programs. Moving to the staff turnover. Organization reports a staff turnover of 19.25% in 12 months. This means 122 employees left, causing a strain on the staffing. The poor working condition and inflexible working were identified as some of the reasons for the exist. Similarly, with 2015 uses the employee turnover measures to measure the wages performance. For instance, in 2014, the reports a total of 102 employees who left for the better working conditions. According to Lasky, organizations can use employees turnover as a lagging indicators to measure the OHS performance. However, while turnover rates can use monitoring the effectiveness of the program, but they are not captured identify the potential risk of the prevention. You look into the absence and sickness cases. MIRAS response absence and sickness causes relevant to workplace stress. It reports 3, 4, and 9 short-term staff absence relevant to anxiety stress in the first, second, and fourth quadrant of 2017. In the same year, it reports 19 and 14 and 13 long-term sickness absence. These are relevant to stress, anxiety, and depression. In the second and third and fourth quadrants, reducing these cases is necessary to improve OHS outcomes. British American Tobacco reports the absence and illness caused to determine the effectiveness of previous measures. For the instance, to report 0.003 rate of occupational illness per 200,000 working hours in 2014 and 2016, and 0.00 in 2016. According to Shinanika, the absenteeism and the illness caused are the commonly used to measure performance of the OHS programs. Talking about the medical cost expenditure, Myers reports its expense on employees. The health issues is shown in OHS performance. In the last quarter of 2017, Myers reported expense on employees' health aimed improving their well-being as well as the productivity. It spent 4,433 euros in the last quarters of 2017. It shows its need to improve the better OHS outcome. Similarly, Unilever uses the cost of work-related illness and accident to determine the effectiveness of OHS performance. Its goal is to reduce the accident and reduce the related expenses and meet OHS performance expectations. According to Almost Health 2018, organization can use the cost of work-related illnesses to measure the OHS performance. We will now look into the evaluation of organizations' HSW performance. Myers satisfactorily completes 2 safety audits that includes an audit and a review of relevant health and safety documentation. This helps to identify the unsafe practices and address them to control work-related incidents. However, this report recommends that the organization develops a formal plan for follow-up to ensure the audit. Recommendations are implemented to improve OHS outcomes. According to Gander and Ragan 2005, having a follow-up plan is necessary for a safety audit to use for a useful and for organizational outcome. Myers has fairly constant pictures of accidents and near-miss reporting. However, it needs to improve the reporting to 100%. According to Moreland 2019, one of the barriers to near-miss reporting is a lack of relevant information. To improve their reporting, Myers should educate and support its staff and the management on making of the importance of making the reports. Analysis of Myers shows that it conducts risk assessment satisfactorily in some areas. However, in some regions, it does not perform risk assessment in sectors like manual handling. To improve the performance, it should develop risk assessment for all sectors to control the general risk. According to Gull, the risk assessment is essential and it helps to identify the areas that need to improve for the better wages outcomes. Myers has the first day induction for every new employees and 12 weeks induction program, introducing workers to issues such as work health safety related policies to improve wages outcomes. It should ensure that every employee completes training within the specific time for efficiency. According to Occupational Health and Safety Administration, ensures that all workers attend training on safety can improve OHS performance. In 2016 and 2017 period, Myers experienced 128 to 120 accidents. An indicator of some safety issues in the workplace is to reduce the incident. It should improve management commitment to safety control through educate and training programs. In 2014, the organization reports soft turnover of 19.25 associates with poor working condition and flexible work. To reduce the staff turnover and its OHS performance, to increase its OHS performance outcomes, it should address workplace structure and layout. This could help to identify the roles of every employee associated with improving working conditions. Lastly, Myers experienced the workplace sicknesses and the absence associated with the loss of working hours. Uh, to improve its outcomes, it should work on its surveillance approaches. For instance, it should continuously monitor the health of its staff for early identifications of work-related health changes. This can help in prevention of illnesses as well as the absence that affect the organization performance. Also, Myers reports expense on employees' health issues and indicators of poor wages performance. To reduce these costs and improve wages performance outcome, it should create a suitable monetary system that will ensure uh, the employees are complying the safety and well-being policies and procedures put in place. So these are my evaluation, and thanks for watching my video. Thank you.